high burnout rate in 16 countries. 19 hospitals in Japan showed 66% burnout rate among 5,956 respondents. In the Philippine Heart Center, there is no available data on the incidence of burnout among staff nurses. However, statistics show that 10.94% of the total population of nurses in PHC are dissatisfied with inadequate social support in dealing with stress and burnout based on the Nursing Personnel Satisfaction Survey of 2011. With this, we developed a program that aims to address job burnout and how to cope, thus proposing the study entitled I-Care, Identification and Coping Actions Towards Recovery and Empowerment Program on Burnout Among Staff Nurses. It sought to answer the following questions. Is there a significant effect of I-Care program on burnout among staff nurses in terms of emotional exhaustion, depersonalization, and decreased personal accomplishments? Is there a significant difference on the level of burnout among staff nurses before, immediately after, and a month after the I-Care program? The study aims to identify the incidence and level of burnout among staff nurses and the effect of I-Care program on them before, immediately, and a month after. The findings of the study will be of value to the patient. This will aid in giving safe and quality health care by increasing work motivation and attitude towards better patient outcomes. To the nurses, this will promote awareness among staff nurses on burnout and will help them develop the appropriate coping mechanisms. To the institution, the results of the study will serve as a guide for the management in providing policies and guidelines regarding a healthy work environment. For the nursing education, the study will serve as a guide in developing programs for preventing and dealing with burnout. For the nursing research, this will benchmark future programs that would address burnout as an occupational hazard. This study used the Lazarus and Folkman's transactional stress strain coping theory, which focuses in evaluating the process of coping with stressful events. The model addresses the relationship between perceptions of stress, coping behaviors, and the impact of personal characteristics and environment on the stress response. This theory proposes that strain occurs when demand exceeds coping resources. In this diagram, work burnout is a result of work stressors that exceed the coping mechanism of an individual. If there is an inadequacy of the needs elicited by the stressful event and the type of coping mechanism that an individual exhibits, burnout may arise. The study will determine the direct effect of the independent variable, the I-Care program, to the dependent variable, burnout, more particularly on its three dimensions: emotional exhaustion, depersonalization, and decreased personal accomplishments among staff nurses. The dependent variables may be affected by the intervening variables. These variables may have an indirect effect on the dependent variables and might affect the behavior of an individual towards a given stimulus. The study will test the following null hypotheses: that there is no significant effect of I-Care program on burnout among staff nurses at the Philippine Heart Center in terms of emotional exhaustion, depersonalization, and decreased personal accomplishments. And there is no significant difference on the level of burnout among staff nurses before, immediately after, and a month after the I-Care program at 0.05 level of significance. For the research design, our prospective quasi-experimental study design will be used with a pre-post-test method to determine whether cause-effect relation exists between the intervention and the outcome. The study will be implemented on staff nurses in the Philippine Heart Center as the following units. Staff nurses in all units, both clinical and special areas, with more than 2 years of experience and with at least 1 year experience in the present unit will be included in the study, while newly hired, newly transferred, and nurses currently under the cross-training program and managerial positions will be excluded. The computed sample size needed for the study is 86 qualified nurses using the proposed sampling scheme for all staff nurses of the Philippine Heart Center. The study will use the eye care screening tool and the eye care screening questionnaire as initial tools used to assess for signs of burnout. While on the other hand, mass burnout inventory, human services survey, or the MPI will be utilized. This 22-item self-help inventory is divided into 3 subscales: independently measuring levels of burnout, emotional exhaustion, measures feelings of being emotionally overextended and exhausted by one's work. Depersonalization measures one's feeling and impersonal response toward the recipient of care. Interpersonal competencies measures feelings of confidence and successful achievements in one's work. The MPI measures levels of burnout as high, moderate, or low for each of the 3 subscales, not as a total. For both the emotional exhaustion and depersonalization subscales, higher mean scores correspond to higher degrees of perceived burnout. Conversely, lower mean scores on the personal accomplishment subscale correspond to higher degrees of perceived burnout. After approval of the designated committee for such a program, a list of respondents who meet the set criteria will be obtained from each unit. The initial screening will be done using the eye care program screening tool and a burnout screening questionnaire. Qualified respondents who provide consent will be scheduled for the eye care program. The eye care program is an 8-hour program divided into 2 sessions, morning and afternoon. It consists of a series of psychoeducation and workshops designed for burned out individuals. It has 5 components: identification and acknowledging work-related burnout, developing appropriate coping actions that will lead to recovery, thus promoting self-empowerment. The participants will be asked to answer the MBI 3 times prior to the start of the program, at the end of the program, and a month after. A checklist diary will be given after the program, which will be collated after a month to monitor the tolerance of the respondents in handling stressors at work. Data collected will be statistically measured using a paired sample t-test and fragment 2-way ANOVA test, and will be interpreted accordingly. To my dear colleagues, we would like to share this quotation. Being a nurse is 90% calling and 10% job. They face life, death, joy, and peace. They never quit learning. Some things they learn, only nurses can understand. They treat the patient completely and with all attention. There will be days when nurses cry on their way to work, and days when they cry on their way home. In the end, when all is said and done, nurses simply have to care and be cared for.